Up to a third of men get prostate cancer if they live long enough. It's more common if you're older, and certainly men in their 60s and 70s are at much higher risk of it than younger men. There are a number of tests you can do to sort of give you an idea of your risk, and the most common one is your prostate-specific antigen. And if you have a high prostate cancer-specific antigen and you're in the right age group, then you can have almost a 50% chance of prostate cancer. So in certain parts of the world, PSA screening has been introduced. So in mainland Europe and in North America, there has been screening for prostate cancer in terms of PSA screening. In the UK, however, we don't screen for the disease. The downside of screening is you find a lot of indolent disease, you have a lot of over-treatment, and many men receive radical treatment for a disease that would never affect them otherwise. In the UK, less than 6% of men, or maybe between 6 and 10% of men, have a PSA test. And the evidence is that, well, we don't really know what causes prostate cancer other than being male and getting older. But there is some circumstantial evidence that suggests if you have a healthy, balanced diet, if you have a lot of vegetables and fruit, so lots of tomatoes, spinach, sort of green leafy vegetables, and if you reduce the amount of meat you intake, so if you, especially if you have less sort of red meat, less barbecued or sort of fried food, then that's better for it.
Yeah.
Well, depending upon the stage of the diagnosis, the treatments differ. So if someone presents with early localized disease, then you would treat them by either just surveying them, so just watching their PSA if they've got a low risk cancer, or radical treatment, which could be the removal of the prostate or radiotherapy to the prostate. If they've got more advanced disease or later stage disease, they may need hormone treatment in there as well. If you've got someone with early prostate cancer, there are two effects to them. One, that they have a diagnosis of cancer, and so psychologically that affects them and their family. And then the other thing is if they can't be cured, then obviously they have problems and they may die from it. And then if they have curative treatment, they may get side effects. They may get some urinary or sexual side effects, which make it, again, embarrassing to talk about. If they've got advanced disease, then the psychology is less. It's much more about trying to treat or slow down the disease before they develop symptoms or die from it. I think if you've got a family history, if you're worried about it, you should go and see a GP and talk about the pros and cons. In the UK, if you ask your GP for a PSA test, you're entitled to have one done, and your GPs can organise that and then refer you in to specialists if need be.